Today we're going to talk about the summertime epidemic of high fevers that's currently whipping through Cleveland. How do we know that there's a lot of high fever? Well, we get calls from families all the time about their young children having fever up to 105.8 degrees, very high fever indeed, and little in the way of other symptoms. We're not surprised to get these calls. And why is that? The reason has to do with this very peculiar germ called the enterovirus. That's E-N-T-E-R-O virus. Entero means gut, and like gastroenteritis means stomach and gut. And in fact, the enterovirus got its name because it causes infectious gastroenteritis or stomach flu every summer. Just like clockwork, at the end of June and through July, sometimes as early as the end of May, we see the enterovirus sweep through our community, and by community I mean across all of North America. It's a puzzling and compelling phenomenon. This virus is completely absent from our world for most of the winter months, and then suddenly sweeps through, infecting nearly every town and village in North America within a few days. As I mentioned before, it's famous for causing the stomach flu of late May, June, July, August, sometimes into September. But this is the virus that causes hand, foot, and mouth disease, which so many people are familiar with. So add to the list this phenomenon of high fever and no other symptoms. When should we worry about fever? So let's talk about that a little. Fever is probably the most common experience that causes the greatest fear in a family's life. Why do I say that? Well, first of all, let's agree that everybody gets a fever. So in my experience, I don't know anyone who hasn't had a fever, and I bet none of you do either. So here's something that happens to everybody, and yet when parents see it in their children, it's very frightening for most people. Why is that? I think there's two big reasons. One is, as parents, of course, we're responsible and care so deeply about our child's well-being that we see them suffer so much with high fever, you can't help but be worried. The second reason, I think, has to do with the big difference between kids and adults. We as adults don't tend to get much of a fever, even if we're very sick. We're not sure why that is. Some people feel it's because our immune systems are older and not quite as robust. But whatever the reason, the fact is that it's very unusual for an adult to get a temperature over 101. And if we get to 102, we're pretty sick. But in childhood, especially young childhood, under age 5, let's say, going up to 105.8 degrees is the normal range of fever. So fevers normally go up to 105.8. Another point I'd like to make about fever is that fever is a very poor guide to know how sick your child is. It turns out that you can have a very serious illness at 99 degrees, and you can have a simple cold at 105.8. So the temperature going up predictably will make you feel much worse, but doesn't mean that you're actually in any greater danger. It is the case that it's very unusual for a person's temperature, even in childhood, to go above 105.8. So if your child truly has a temperature of 106 or above, that is something you need to contact us urgently and immediately about. I will say, over the years in practice that I've experienced, I've never seen a child truly go over a temperature of 105.8. And that gets to our next point about fever, and that is, it may feel as though it's an out-of-control event, but fever is actually as tightly controlled as a normal temperature. The difference is that right now my temperature is 98.6. It's very tightly controlled. If you take it this morning, if you take it this evening, it's going to be the same temperature. It could be that temperature if it's cold outside or warm outside. It is tightly controlled. And so we all feel as though when our kids' temperatures go sailing up to 101, 103, 104, that something's broken. But the point is the body creates the fever. It's not the germ. So fever results whenever the body wants to create a fever. That could happen with a mosquito bite or inflammation from something that has nothing to do with infection. So when our body decides to make a fever, it changes the temperature, say to 103.8, and maintains that 103.8 as carefully as it does at 98.6. So fever is not a situation where the train has run off the tracks out of control. One way to think about that is try to set your oven for 323.6 degrees. It's essentially impossible. You might hit 320, you might hit 325, but you'll never hit 323.6 and keep it there for hours and hours. We don't have that much accuracy. So when you see your child's temperature hover at 103.8, keep in mind there's a lot of technical accuracy and control that the body is still enforcing even during times of fever. So what do you watch out for when this high fever illness happens? Well, same thing we would whenever any fever occurs. In children, fever is typically a sign of infection, and so the question in my mind is this a serious infection or a mild one? A serious infection is something that might cause harm. A mild one is an infection that when it's over, you'd never know that anything ever happened. It's completely harmless. Enteroviral infections tend to be harmless, but any infection can go from harmless to harmful, and the key signs that you've moved into a harmful state is if your child's experiencing 1, a lot of pain, 2, difficulty breathing, getting air in and out of their chest. They might be snorty and having trouble in their nose, but they're tugging like this. Then you know they're having trouble getting air in and out of their chest. And another problem would be a stiff neck, meaning they can't touch their chin to their chest. If they try to look this way, they can't move their neck. That's different than being able to move your neck, but your neck being sore. A sore neck is not worrisome, but a stiff neck is something we should know about right away. So difficulty breathing, stiff neck, severe pain. These are the key things to watch for if your child has a fever, no matter what that number is. If your child is uncomfortable with the fever but breathing well, moving their neck fine, not in any particular amount of pain, then it's fine to treat the fever with the usual techniques. A word on that, we recommend the use of ibuprofen because of an association between Tylenol and development of asthma. This has not been proven to cause it, but until that's sorted out, we are recommending ibuprofen. Remember, fever itself is harmless. So you don't want to trade a harmless, even though very uncomfortable symptom for a harmful situation such as a drug overdose by giving too much Motrin. Motrin should be given at the recommended dose no more often than every 6 hours. So when your child has a high fever, it's no time for panic. The fever will pass. Know that fevers go up and down. We're also very reassured that if the fever goes down in the course of the day and your child seems to be feeling better, that's probably a mild illness also. So to put that together, we are seeing an epidemic of high fever this summer. It comes along with the annual epidemic of enteroviral infections we see every year. These viruses typically cause hand, foot, mouth disease and stomach flu. They can cause a high fever illness. We're seeing that now. That illness can end with a rash. If your child's breathing well, seems comfortable and no pain, and does not have a stiff neck, then temperatures up to 105.8 are acceptable and within the norm, and not too much of concern. Of course, if you are worried and you'd like to talk to us, we're happy to field your answers if you're part of our practice. And we hope that your child, if they have this fever, gets over it quickly. And we wish you a very happy and healthy summer. Thanks for tuning in to Real Answers with Dr. Arthur Lavin. We'll see you next time.